So I would now like to invite Simon Nugent to take the stage. And Simon is the CEO of the Private Hospitals Association since 2015. Simon has a background in public policy and business representation. He was previously the CEO of the Chambers of Commerce of Ireland. And between 2011 and 2014, he was Special Advisor to the Minister for Communications and Natural Resources. And he's currently a member of the Government National Clinical Effectiveness Programme, to which he was appointed by Leo Varadkar. And Simon will talk to us today about the 6-point plan for public-private partnership, which again, I think will give us very tangible insight into the proposals from the Private Hospitals Association of how that partnership between the public and private system can be built into the future. So Simon, if you'd like to come forward.
Well, thank you, Mary. Good afternoon, ladies and gentlemen. What you might also have inferred from Mary's introduction is that I'm not from the health sector. Indeed, until a year ago, until I started with the Private Hospitals Association, I wasn't working in the health sector at all. So forgive me if some of the things I say are not exactly using the language of the sector. What I want to do just for a couple of minutes is to push the Private Hospitals Association, or put the Bon Secours perhaps in the context of the Private Hospitals Association, and talk about the significance of private hospitals and what we do in the health sector in Ireland, because it's a bit different to other countries, and it's worth bearing in mind. And then I will indeed turn, as Mary says, to talk about the specific issue that Bill wanted me to talk about, which is the particular type of partnership that we in private healthcare in Ireland can have with the public system. But let's, if I can find out how this works, let's just talk about private hospitals for a moment in Ireland, because the private hospital network in Ireland comprises 20 hospitals. It is a nationwide network. We have hospitals in 10 or 11 counties around the country. All of our hospitals are internationally accredited. It is a rule of membership with the association that any hospital must have internationally approved accreditation and maintain that accreditation. And that provides a system of continuous quality improvement, which I think is a very useful and important rigor in the way that we work. And Harry listed some of the different accreditations, indeed, that Bon Secours hospitals have. All of our hospitals are delivering 24-hour acute and 24-hour supervised acute mental health or acute care services. And again, the clue is in the name, as somebody said this morning. We used to be known as the Independent Hospitals Association of Ireland, but in the spring of this year, we rebranded as the Private Hospitals Association, because all of our hospitals are indeed privately owned, whether by not-for-profit companies or companies limited by guarantee, or whether they're owned by shareholders. And that's probably an important differentiation. It gives us enormous flexibility and autonomy in the way that we work, and it's sort of the central element of how we actually contribute to the health system. The members of the association are on this slide, which will also be in your pack. There are 15 companies, 15 entities own the hospitals. Obviously, the bonds accounts for 4 of the hospitals. There's the list just for the record of our members at the moment. And recently, the association agreed that St. Francis Hospital in Mullingar would join the association as well. The association has the responsibility of speaking on behalf of our members. And traditionally, our role in speaking on behalf of our members has been to government, to the regulatory environment, to professional bodies, to a certain extent to the media. But I think as we see the next year go on, we'll see the association speaking much more to the public about the role of private hospitals in Ireland and the work that we do. So that's something that's very much in our work programme for the coming year. What do we do? Well, again, Harry has given you an insight into what the bonds do, but just to put that in the slightly larger context, we supply over 1 million bed nights each year to patients in Ireland. We provide treatment to more than 400,000. We account for more than 250,000 surgical procedures, including very high proportion of both cardiac and spinal surgeries. In fact, we estimate that we probably deliver about 50% of all elective procedures in Ireland are provided through hospitals in our network. 3 million diagnostic tests a year, and we're a significant employer in the Irish economy. More than 8,000 people work in hospitals in membership of the association. Turning to the specific point that Bill asked me to talk about, which is the partnership that might be achieved between private hospitals and government. In April of this year, we published a document which we submitted to the new government and to the incoming Minister for Health on 6 proposals to improve patient outcomes through collaboration between private hospitals and the public healthcare system in Ireland. They were to tackle waiting lists, overcrowding, recruitment, commissioning, capital investments, and most importantly of all, to try and tackle dialogue. So I just want to take you through them one by one for a moment. The most obvious one, and the one that's very much live in medical policy as we speak, was to design a joint public and private sector initiative to tackle waiting lists for inpatient and outpatient treatments, including a focus on diagnostics. Now, if I skip forward 2 slides. This is the one that Bill, these are the same numbers that Bill showed you before, so of course you'll see them often again, but there is a remarkably high level of people on waiting lists for a remarkably long length of time in Ireland. We all know that, but the question is what can be done about it. We were pleased to see, and we welcomed the fact that, that Minister Simon Harris announced a new initiative in the budget this year to relaunch, if you want, the National Treatment Purchase Fund. The funds to be contributed under the fund during 2017 are relatively modest, as a commitment of 20 million euros. However, the Minister also highlighted the fact that he'd secured agreement in government that the following year that the funds committed to the NTPF would be increased to 55 million at a minimum, and obviously we welcome that too. We welcome it because it's an increase in funding and therefore an increase in the possibility of responding to patient needs, but we also welcome it because it is a first gesture towards long-term planning, because what we said in our submission back in April of this year is that what's absolutely critical in terms of planning for care in Ireland is that one starts to get away from a 1-year approach, a 12-month by 12-month or 3-month by 3-month approach to spending resources, to actually committing to multi-annual funding. So we look forward to seeing the National Treatment Purchase Fund being developed on a multi-annual basis and to actually tackling the sort of the scale of waiting lists that face us in Ireland. We can do quite a lot about that. You can't do all that much for 20 million, but we're prepared to roll up our sleeves and to get cracking immediately in January. And when we met with Minister Harris a couple of weeks ago, we said that to him. And indeed, I have a meeting with the National Treatment Purchase Fund tomorrow to talk about the modalities, as they call it, of how this is going to work. We've also been considering the question of the extent to which there are patients currently on public waiting lists who probably have private health insurance. And we believe there's quite a significant cohort of patients who are in that boat, but who, for one reason or another, have been referred by their GP to a public hospital for treatment. And we're going to take steps in the very near future to urge those patients to consider whether or not they might be able to be treated more swiftly if they considered making use of the private health insurance that they have and that they've invested in. We're going to say to them, you've paid for it, you should use it. The second proposal that we put to government was that we could work to deal with the pressure that faces emergency departments. Now, this is a complicated area, but we believe that the resources of private hospitals can be used to make a significant difference in terms of getting people who are currently presenting at public emergency departments to see whether we can get them treated easily, maybe to keep some of them out of emergency departments. And even those who are in emergency departments, perhaps some of them we can help with the treatment of some of them. This is a complicated area, and we have made specific proposals to government that we should have a close dialogue both with the department, with the HSE and with hospital groups to see what practically can be done. But certainly it's worth remembering that we already in emergency departments and MAUs in private hospitals in Ireland treat over 1,000 patients every week. We offer inpatient care. We admit to inpatient care more than 250 of those patients each week. And we provide at least 70,000 bed nights a year to patients who are admitted through our own emergency departments or medical assessment units. That in itself is a very significant contribution to tackling emergency department overcrowding. And it's one that the system tends to ignore, tends not to bear in mind. If there weren't emergency departments and MAUs being provided by members of the association, there would be significantly greater pressure on the emergency departments in the public hospital system. The third area that we've urged government to work with us on is workforce planning. And we believe there's a significant need to address the gaps delaying patient treatment by launching a coordinated approach to attracting consultants and other health professionals to work in Ireland. And that this is something that's not a zero-sum game. Sometimes when I listen to the public discourse about this and the manner in which the issue is framed, particularly by trade unions, it's presented as if there is a problem with recruitment in the public health system in Ireland because private hospitals are stealing all the staff or something like that. But this is not, as we know, this is not the game in town. The reality is that there is a ferocious demand for health professionals across the health system in Ireland, and what we need is a coordinated, joined-up workforce planning strategy to attract people to come and work with us. And that's a shared goal, and it should be a shared goal of both the public and private systems. In the case of clinicians in particular, the issue that arises is very much the issue of the sort of contracts that are available to attract people to come and work in Ireland or to come home and work in Ireland. And we have to be much more imaginative, much more creative about the sort of contracts that are on offer so that we can ensure that people see the logic of coming back probably to work part of the time in the public system and part of the time in the private system. And that way you maximize the opportunities to get relevant experience and to treat as many patients as possible. So there's a big job of work to be done in terms of joined-up thinking and in terms of workforce planning. I'm pleased to say that the department is engaged in a significant piece of work now on workforce planning, and we've been invited to get involved in that work by Minister Harris, and we welcome that invitation. Commissioning care is obviously an issue that's been in the plans of the Department of Health for quite some time. The whole area of how we commission care and who has the opportunity to tender, to bid, to provide care is something that is, as I say, has been on the blocks for quite a while, but it requires some momentum to be put into it. And therefore, we've suggested that the government should set itself a target of moving towards this system by 2018. We've had quite a bit of discussion earlier today about capital investment planning, and the association's view on this is that we should, together with government, coordinate planned investment in medical facilities and equipment to avoid duplication, get value, and to create efficiencies. There is, as you heard this morning and also from Harry this afternoon, there is an absolute commitment from the Bonds Group to invest 150 million euros over the coming few years. There is also a commitment by many other hospitals in membership of the Private Hospitals Association to invest. So there's a very significant investment going to happen over the next few years by private hospitals in different elements of capital. And we really need to make sure that that sort of investment is aligned with any capital investment plans that there are on the government side. The government side has been very severely constrained in terms of the amount of capital investment that's committed in the current plan and in the forthcoming plan. Once built the Children's Hospital and developed a couple of other things like the new mental health hospital in Portrane, there's relatively little cash available for the future. What is important is that we don't duplicate these investments and that we therefore make sure that we have the best kit available to treat as many patients as possible, rather than having some things invested in twice and other things left completely loose. The final one of the 6 proposals is probably the most important of all, which is that we need a sustained dialogue between the public health system and private healthcare providers in Ireland. And we've urged the Minister to establish a specific task force that would boost this sort of cooperation between the 2 systems over the future. Historically, I think the private system has been treated as some sort of a remote or semi-detached element of the health system in Ireland. And really, if we're going to pay attention to patient care to the maximum amount in the future, we need to change that position, and we need to acknowledge the scale of work that's done in the private system, and to see how that can be worked together. And there's quite a wide range, quite a long agenda of things that we could work on there. For example, the area of quality, accreditation, and licensing, as I mentioned already, all of the association's members are internationally accredited. We're working with the department on all sorts of areas related to accreditation and licensing. The area of e-health is a very important area. It's one that perhaps we haven't discussed all that much today, but it's very important that the way that patients are treated is handled from an ICT point of view seamlessly between public and private systems. And we're working quite closely with the CIO of the HSE, Richard Corbridge, who attended our council earlier this year, and who will also be talking to our CIO group later in this month, to make sure that the same systems operate from an ICT point of view, so that we can make sure that patients can move seamlessly between the public and private systems as is required. There are other areas where we can cooperate: emergency planning, analysing the implications of Brexit for Irish healthcare, working on things, innovation in areas such as clinical trials, as Bill mentioned before, and also the whole area of professional development, where private hospitals, I think it's often not recognised the extent to which private hospitals actually do partner in the professional development of all sorts of different clinicians and healthcare providers in the system. So those are the 6 areas where we envisage close cooperation. I think it all sums up, though, as an argument, a strong argument, that we will have an integrated approach to the ever-increasing demand for healthcare services in Ireland, and we have to be sensible about how we make use of all of those resources. So I'm going to leave it there, Mary. Thank you very much.